Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well,
Good morning. Good morning.
Look,
did you notice how beautiful it is outside?
Beautiful.
We always have
yes,
that big
it's
view.
Beautiful. We got this view.
Yeah, it is great.
Yeah.
So,
welcome to South Florida.
welcome to South Florida. So, Ina, is this in Russia right now? Would it be very cold?
Oh, it's so winter.
Yes, I have spoken to my mom a few days ago, and she said it's been really cold for a
Like
couple
how
days.
cold? How cold?
Well, I don't know, in Fahrenheit and
No,
Celsius
but-
it was like 25
Below.
negative, below zero.
Oh,
25
my.
below zero.
Well, did Dr. Mencia, does that, I would always think that the cold weather and the dreariness affects people as they age.
Yes. As the weather tends to drop and the atmospheric pressure changes, it will affect people's joints. It affect people's emotions.
Yeah, the emotion.
That's why you hear in psychology and psychiatry seasonal depression. Some people during the winter time will become depressed because it gets darker. We have less daylight hours. So imagine in Russia that you are more north, more toward the North Pole. Of course, they get more snow. There's less way of getting around. So you
And the
sort of...
sky, well, excuse me, I think in Scandinavia the skies are much brighter, but I think in Russia it's dark.
It's dark,
See,
right?
that's,
Yes.
yeah,
Right.
isn't it? So,
Right. So all of that tend to, the darkness. As a matter of fact, one of the treatment besides, using medication, for those people that don't like to take medication during seasonal depression, we tell them to get those big fluorescent light in their apartments or their house to brighten their house, really, really bright. And having the house lit up like that tend to help a lot with the depression.
that's very good advice for our people now, because when I come home, I turn on the lights immediately, all the lights.
All the lights on.
And even Charlie, my dog, if I have left and didn't know that I was going to be come home later, because usually if I know I will leave lights on and it's dark, he hangs around the front door where there's a little light, just because I guess he doesn't want to be in the dark.
Right. And,
Sorry.
through the eyes, your eyes is the window to the brain. So imagine when you turn on the light, it's like taking an overdose in melatonin. So you will wake up. You will feel much lighter, more awake. When you turn down the light, when you go to bed, you turn down the light, melatonin level tend to increase so you can sleep. As the daylight comes on, melatonin level tend to decrease and you wake up. So that's why you see people taking melatonin to help them, get a good night's sleep. So it's important to, during the nice and romantic.
But just look at the difference.
There's a big difference. Look at that, because we have the fluorescent light. So when you turn that down, then and that that's another thing. If you have at home LED lights that are very bright, that helps a lot versus the old boards, the old light boards. Like this one, that's an old light board. So if you change that one to a LED light board, it will brighten up. So, so as melatonin, as we just discussed, by changing the input of light to the retina in your eyes, it goes into this gland in the brain and affect the level of melatonin. So the same thing happened with depression and a lot of mood disorder. During the winter, we are more prone to have a decompensation in our bipolar, our schizophrenia, our depression, our anxiety. So just being in the winter, that affects us. Now you add the holiday to that, which means during the mid-December to early January, mid-January, is when we see the most admission to psych hospital for decompensation. We start with Hanukkah, and then come the Christmas holiday and the New Year holiday and the Orthodox Christmas and what have you. All of that take place usually between mid-December and mid-January. And what those holidays, to most of us, is sort of increase the level of stress. So increasing the level of stress is like, it's supposed to be a good increase. It's supposed to be something good. But when you are a person with mental issues, mental disorders, it can exacerbate to such a level that you might need to commit yourself to a hospital because you cannot handle the stress that you've been put through because of the holidays.
All right, but when you have patients who come to you, do they share their feelings with you about
that? They do.
And what would you do? So what do you tell them besides lights, which is a very good suggestion? Everybody listening, go get more lighting. If you have to buy plain lights and put them somewhere, light is really important, and put it on at 4 o'clock in the afternoon.
And this is the time to give a little extra money to FPL and just light up your house. Don't light up just the room that you're sitting in and have the rest of the house dark, because that sort of isolates you. So don't be isolated. Don't get controlled by this situation. Just take over, take control, take charge. Light up the house. And I do the same thing. When I go to my place, I light up my place. When I go to the office, even though I get there before the dental department gets there, before administration get there, I get there very early, I light up my office, the entire office. And when I'm walking around, the whole office is lit.
Yes.
So I feel, better. It helps out. So then you ask me about the patient
yes.
when they come.
Yes.
And they feel stressed because they have to buy gift or they have to be in compliance with this and that. And what I tell them is like anything else in life, now you are the executive administrator of your life, and during these holidays, and if you are going through Hanukkah, you have to buy a gift. So organize yourself. If you're going to Christmas and you have to buy a gift, organize yourself. And there is nothing wrong with forgetting somebody because you are human, and you only worry about who you forgot when you remember. Uh-huh. You're never going to worry about who you forgot, and you continue to forget that person. So, just get organized, and some people feel that you have to reciprocate who gives you. And that's not what the holiday is all about. If I give you something and you give Ina something, then that's what the spirit is all about. It's giving forward. It's not giving to each other only. It's nice, when we both think of each other at the same time. That's beautiful. That's nice. But when we pass it forward, and you see people sometimes when they have a lot of money and something is coming up, some event, and they say, don't bring me a gift. Just give it to your best charity or pass it forward.
Yes.
So, if you feel like giving, if you feel like doing something, just pass it forward. You don't have to go, oh my gosh, Mary gave me a gift and I didn't buy her something. It's okay. There's nothing wrong with that.
Right.
You don't have to give Mary. Give Joe. Give somebody else. Give the Salvation Army. Give, the Red Cross.
St. Jude.
Yeah. And sometimes if you watch TV, they can make you feel very guilty because you get all this commercial on TV. Kids are dying, so many kids, donate to this, and then the other one, and the dogs and this, and, and donation left, donation right, and you feel like, oh my God, you start like sinking into your couch. So, Remember this strategy people use, organization use, it costs them a lot of money to put a strategy there. And at the end of the day, you have to do something that make you feel good. We give not to make the other person feel good, but also to make ourselves feel useful and doing something good.
Well, the other thing I was going to ask you about, though, that because it is now holiday time, you can that people are inviting, friends over, and you find when someone's depressed, they don't want to go to anything; they just want to sit at home, and I think that's.
That means you threw the tower.
Yeah.
You have thrown the tower. I get invited to a lot of events and stuff, and hey, if I'm working, I cannot go, I won't go. I just keep working, keep doing my thing. But don't let depression take over you. Don't throw that tower,
But do you want to give them something to take, that medication, or do you want it, is there a certain kind of food?
It depends.
What could they have that would help them?
What you don't want to have is a lot of alcohol, because it's going to make the depression worse. And if you are prone to suicide, then you're going to be more likely to fall into that trap. That's one thing for sure you don't want to have. You don't want to, if you suffer from bipolar or schizophrenia or one of the disorder, the depression we call the down disorder, the anxiety, the bipolar mean that you can have the up or you can have the down. So with those disorders that tend to make you hyper up, too much sweet, too much candy, you have to be careful with that because that can make you jittery. Too much coffee, versus more tea and water. So when it comes to food, the same thing. You get so busy, so tied up, going from one party, one meeting, and this and that, and then you get home late and you eat. You're going to have a tendency of gaining weight that is not good for you. So you want to make sure that you have your regimen well taken care of. And even during the holiday, I still go and eat my salad. I still, do the holidays. They are here, but I'm not going to. We get at the office from all the reps and the different company that we work with. And I say, why they have to give me so much sweet? I mean, can they think of something good?
Yeah.
And yesterday,
give it fruit and stuff.
Yesterday I had one that brought some
edible arrangements.
Fruits.
No,
the juice. The
juice smoothie.
The smoothie,
right?
Healthy smoothie.
Well, that was great.
And that was great. I say, wow, good. Somebody's thinking that even though we are in the holiday, that we can, let's eat healthy. Give healthy stuff. I don't like giving chocolate and
that's what we're all getting, and it's very, very bad, and we shouldn't be doing that. But let me tell everybody, we always jump into this so fast, but you're hearing Dr. Andy Mencia, and he's really a testament to what a good medical physician, what a good medical doctor should be, and we really admire him so much. I know I especially do, but everybody does. When you talk about him, he's such a very, very nice man, so smart. So let's get you to go over and meet with him. The company is called AGI. The medical practice is AGI Medical and Dental Centers because they have a fabulous dental center in both of their locations, one in Boynton Beach and one in Fort Lauderdale. But Dr. Mencia rushes out of here from the radio studio, and he goes to his center to start to take care of people. So this is the holiday. Don't wait. If you're not feeling well, you have a little touch of the flu, you're too sad, go over there and have a meeting with him. In 5 minutes, you will find that you'll feel so much better. He's such a bright, shining star. And the other people who are home, and I know it can be very depressing at home, but if you need services, he can provide those. He's really good at this. And I know that Ina has taken over a lot of making sure that everything works perfectly. And so you'll get to meet her, too. She's so pretty and so nice. And so let's just give you a phone number. If you need to make an appointment, call 954-489-1345. That's for the Fort Lauderdale. If you want to go to Boynton Beach, and I don't know, they're always open now on Saturdays, aren't they?
Yes,
Okay.
yes, we are.
that's-
Both the medical and the dental, and I don't know what
and
consulting
now
we
we're going to
today.
have a hearing center there too, so that's
Yes,
going to be
yes.
interesting. That's
Yeah.
going to be interesting. 561-270-6494, and they have a nutritionist who is really wonderful, and you can do this as a patient of Dr. Mencia's, and so they have lots of services, but the most important thing is that Dr. Mencia has been giving out great medical advice for years now on this radio show, and we certainly appreciate it. And of course, the articles that we're having now will be in the January issue will be on dietary, how to eat properly and all the myths that are out there.
Right.
But let's get back to the mental part. Yeah. So here it is. Going to movies. There's some wonderful movies coming out that people should see. There's a good one on Churchill that's coming out for World War II people. But the biggest thing, Dr. Mencia, is, of course, the Boomer Expo coming up in January the 16th, which
and we have a new location.
Yes.
For the Boomer Expo.
Yes.
Oh, no,
the Cure Symposium.
The Cure Symposium, we have a new location.
No, we're still here, though, at the casino, but, yes, we will have a lot of your people from the let's talk about the spa, Stonewater Spa.
Stonewater Spa, especially now during the holidays.
Yeah, that's where they should be. Why don't you tell us some things about this med spa?
I went there last week. And
I know you did. I know you were all set for your party. Tell us about the med spa. Why do you like it so much? I see your nails are gorgeous. You must be going there.
She's abusing the med spa.
That's right.
Look at her eyelashes.
That's right. She's got all this stuff
getting
going.
all the facial.
It's a holiday
keeping
season.
the hair like a princess.
No, we have a lot of holiday packages in the spa because of the holidays. You can go and if you want to give a gift to someone or you want to pamper yourself, we have, I would say, about 3 or 5 packages, different packages, and they have different names. The love package or joy package, and it includes different things that...
For instance, what does it include?
Well, it includes different things, different type of massages, different types of facials, things like that.
Well, like you do manicures, pedicures?
This is called a joy package.
Mm-hmm.
Yeah.
When you leave,
it depends depends on the amount of time you'll spend in the spa. So it's combination of different things.
And this I tell you, because I go there not as an owner but as a consumer when I go there, and when I go there, if I'm in a rush, there is like Indianapolis 500 when the racing car pulled to the side. If you have a short amount of time, but you still need things done, they all schedule things so that you have one person doing your feet, another person doing your hands. They work on you at the same time. Another person doing your... I mean, you can really get the whole treatment, and the quality of time is still Class A. And they really just, come and take good care of you, and,
They're very sweet there. They're really nice. You have infected them with that sweet disease. But talk about the salt. We don't talk about that very much.
Yeah, it's like when you go to the Dead Sea and you go into you submerge yourself in the Dead Sea, and when people that have had that experience, your whole skin feel like so rejuvenated because the salt content on the Dead Sea will extract all the dead skin, exfoliate your skin. And even people that have, a lot of people that had a rash that had not been cured with medicine, they go there and they get the improvement, and they want to travel to the Dead Sea more often because of the medicinal effect of submerging in the Dead Sea. So... And
so do you have the Dead Sea there in your spa?
We have the Dead Sea in the spa. We have and it's a nice Dead Sea because you don't get wet. So you go into this chamber, and it spell concentrated salt, and that salt go all over your body, and you stay in the chamber for 20 minutes, let's say, and some of my friends that are reps that come to my office, have told me that, I went and I tried the salt bed. I got in the chamber and I did it for my skin. But when I got out of there, I said, oh my God, I cannot believe how well I can her breathing. Mm-hmm. She was saying my breathing got so much better. I can breathe.
Why is that? Why does it affect your breathing?
Because when you are inside that chamber, you still breathing. So you are inhaling that concentrated salt, just like when you go on the desert. You submerge yourself, but you leave your head outside. And when you inhale, when you are submerged in the desert, you inhale the the air that you are inhaling is loaded with salt. And then salt will, if you can imagine, salt will tend to, by osmosis, pull out fluid from the other side of any membrane. So it will pull out any excess amount of bacteria, excess amount of fluid, and it opens your sinuses. So when a person has asthma or sinusitis or any type of sinus allergy, the mucosa, which is the membrane that covers your nose and your sinuses, is inflamed. So the treatment usually when you go to a regular doctor, what we do, we give you steroid. And steroid will decrease the inflammation, but then you have to use it for a long time. Well, if you take your head and cover yourself with a towel and open the hot water, you get that steam coming in. And that steam, when it goes in, it tends to make your mucosa sweat and get the excess amount of fluid, and you can breathe better. And sometimes people put a little bit of menthol and open the hot water. It's old remedy Grandma used to do to all of us. And we put our head inside the steam coming out from the hot water, and we feel better. We can breathe better. Well, salt will do the same thing. Salt will pull out that excess amount of fluid, the inflammation that we have in that mucosa, pull the inflammation out, and people come out and they can breathe better.
Okay, but what about people who have high blood pressure and they don't want salt? That's not the same.
It's not the same
salt
because you are not
exactly.
It's staying on your skin, on your sinus. It's not the amount of salt that you will ingest. So if you eat salty food, that is going to get processed. It's going to go into your bloodstream. So that's a great question because it will not affect your blood pressure whatsoever because it's outside. So it's outside, your mouth, your nose, you're just going to inhale this concentrated salt, but you are not ingesting heavy amount of salt. So that's a very good question.
Yeah,
that's
so
an important point.
All right, but you said it's dry, so you're not like you do have, there is a bath there, or what do you call it?
Oh, Vichy shower.
Now, what is the advantage of that?
And we do there also the different type of scrubs, which is sugar or the salt scrub. The exfoliation, skin exfoliation. So like sugar is more gentle on your skin, and people who want to go deeper, they use the salt one.
No, wait. Mm-hmm. So the sugar, they literally put
sugar. Sugar with and you can choose the different types. We have sugar with honey, honey and milk, Cleopatra treatment, whatever we have there. Yeah.
And that go back to Egyptian time. Mm-hmm. It's nothing new. What we do in Stormwater is treatment that go back, thousands of years. And, the queen and the queen will be, to preserve her beautiful skin. They will get the sugar treatment. But if the family member have rough skin or have rash or something like that, then they will get the salt treatment. So
this is really marvelous. That's why it's a med spa. Are you doing? Someone mentioned about you're doing Botox now.
Well, yeah, that's what makes a med. Since I'm the medical director, being an MD, we can, as a med spa, we can open from nails and hair all the way up to laser treatment, small surgery.
You have your gynecologist working
We
there,
have
too.
the gynecologist also doing vaginal rejuvenation. So, we're doing medical treatment and the spa
we have to
treatment.
say goodbye. We've had a wonderful.
It's a great show.
We really covered a lot of things. Thank you.
So if you're feeling depressed, go to the med spa.
Give a number for the Stonewater.
Okay, Stonewater 954-561-8799. Again, 561-8799. It's area code 954. It's over there in Oakland Park Boulevard, and just call them, make an appointment. You will love it. Treat yourself. That's your holiday gift, right? Thank you very much,
Merry
both
Christmas.
of you.
Thank you. Happy holidays.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.